For our final episode of Season 2, we sat down with our own nurse, Nicole, who's proof that adventure really can be a career path. From managing medical emergencies on a ski bus to now carving out a career as a travelling Kiwi nurse in Australia. Nicole's proof that if you can be flexible and adaptable, you truly can build the career of your dreams.
The bus driver is telling me that there's someone on the bus having a fit. Oh. So the door opens, walk onto the bus, I'm by myself, and at the end of the bus there's a lot of commotion, and then managed to make it through, and he's unconscious, not breathing, and so this man essentially had a VF arrest on the back of the ski bus, and we managed to bring him back with 2 shocks, but all done in the back of the seat.
It's our last episode of the season, so be sure to be following us on Instagram so you can get to know our guests, like Nicole, a little bit better over the Christmas holidays. And don't forget, wherever you get your podcast, to subscribe and leave a review.
We care for the land and sea. We care.
Today we're joined by Nicole Watts, a New Zealand nurse who spent years leading medical teams on the ski fields of Queenstown, working in high-pressured, isolated environments where every decision counts. Nicole's story, though, is not just about snow and adrenaline. She's also part of our CMR community and regularly brings her skills and experience across the ditch to work here in Australia. Did you all hear what I did out in the ditch? Welcome to It Takes Heart, Nicole.
So sorry.
It happens
sorry
everywhere.
All Kiwis out there.
I thought we were more common. But no, the accent's still a novelty.
The accent, it probably is, and I apologise in advance.
Your accents do tend to just crop up. But
here we go. Can we start though? Ski fields.
Yes.
In Queenstown. How long have you been there? Like, what a job! And I'm not a very good skier.
Have you done this? Have you been to Queenstown?
Yes, and I did ski for one day. I fell off the chairlift. It had to get stopped. And then when I came down around the mountain, I was pizza, and I was on my own because they'd left me because I was holding the group up, and I was pizza. And then I saw this couple making out on a barrier, and I could see them, and you go to where you're looking, and I was yelling, no, and I took them out, and we all went through the barrier, and I had all my skis everywhere, and I just stomped off. I had one still on and one off, and I couldn't get the other one off, so I stomped off with my skis. So my question is...
You're really giving Bridget Jones vibes.
It was very Bridget Jones.
You did everyone of service, breaking that make-out session up on the hill.
This is it. Yeah. They're probably married now, but it was a lot. Do you have to be a good skier to work up there?
No, you don't.
Really?
No.
Are you?
Well, I've been doing it for a little while.
Yes,
I originally snowboarded since the age of 18.
Wow.
And loved it. And
so you grew up in New Zealand, was it in Queenstown or?
I grew up in Christchurch, so 6 hours north, so Mount Hutt actually, I would call my home mountain. So when I was 18, my parents were not into it at all, so it wasn't a thing we did as children. And then friends enjoyed it. So I think at that age of when you can start paying for things and, funding your own life, you get to learn to snowboard.
Yeah. So you're a snowboarder, not a skier?
I do both now. I guess, you turn 30 and you take on new challenges, and I was like, I want to learn to ski.
Yeah.
So the last 2 seasons now I've been predominantly skiing and loving it, but I would still say I'm a snowboarder.
Yeah.
Do you get much time to do that when you're working in ski seasons and things?
Yes and no. It depends on the time of the season. You kind of, the season starts early June. You've got 2 weeks to settle in, get everyone comfortable, and then it is baptism by fire with school holidays.
Yeah.
You've got New Zealand, you've got Australian school holidays, everyone's coming, and it's about a solid month that is really busy.
Yeah.
So we get out when we can. Most often it's sort of first thing in the morning.
Yeah.
I feel like anything from 11 till midday, people start to get tired. And
instead of going for a run, go for a quick ski.
People do. It's so accessible in Queenstown, from where I was living, it's 30 minutes from my door to the top of the ski field.
So do you, because there's like about 3 ski fields around Queenstown, is that right? Like Coronet Peak, the Remarkables.
Yeah. And then you've got Cardrona, which is a little bit further. And then there's also Treble Cone. So there's 4 mountains sort of within the Central Lakes area.
And do you work on one of the mountains?
Yes.
Right. And so every day for work, you go up to the mountain and you're stationed there waiting for people like me to break bones and take people out.
Yeah, that's my job.
Can I go back? And
To which bit?
before we get to there, how do you get into that sort of work? Or, you know,
How do you qualify?
Yeah, was that always the dream once you started skiing and snowboarding and thinking, oh, I could do that?
I think it was something that just came by chance. You know, you spend a lot of time up there and everyone sees ski patrol in the red jacket with, you know, what they call the blood wagon and
really?
the people on
The
the
blood
rig.
wagon.
Yeah,
Wow.
that's a reference people call it. And it looks cool. But I guess I never really thought much more about how I, you know, working as a nurse can do that.
What were you doing?
Like, what were you doing before?
Yeah.
Sorry, we get very excited,
No,
particularly me.
I was working in an emergency department in Queenstown. So there's a small rural hospital there. So I was full-time in the emergency department there.
Right.
And yeah, it was actually another colleague of mine who got me into that initially. She had taken on a job with a company that provided the medical cover on the ski field. So it was then sort of a contracted company coming in and doing it.
Right.
And she needed a job share. She was working part-time at the hospital and then got a full-time job, which she couldn't commit to up there, and asked if I would be interested in doing that. So I did.
Is the emergency experience really critical in those roles? Like, what do they look for? Or is it more of almost a general practice with a bit of emergency? Or what's the...
Yeah, I definitely think having emergency or critical care background is quite pertinent to working up there. Obviously, you know, 75% of what you're dealing with is orthopaedic injury. A lot of bony injury, musculoskeletal presentation. So that also is beneficial. So, you know, I don't completely overlook people who work in urgent care centres that also would have that minor sort of musculoskeletal presentation experience as well.
So what would a typical day look like up there?
A typical day, we get on the staff bus at the bottom of the hill at 7:30 and you get this nice drive up to work, and then we work very closely with ski patrol, so we're actually technically under the same department umbrella. So 8:15 we have a meeting with them in the morning talking about snow condition and plans for the day. And
So they're the people who are running the safety of the
yes,
ski resorts and things, are they?
yeah, so they are the red jackets that you see out there that
Yeah.
you know will be up there at 4:30 in the morning doing avalanche control work if it's been snow heavily, so that we can ski safely.
Feels like the lifeguards of the snow.
Basically, they are out there doing all the hard work. Yeah, they're amazing at what they do and they love it. So they get multiple control days at 4:30 in the morning where they can throw explosives and trigger avalanches to prevent sort of
One happening
one
later on.
happening
Really?
unexpectedly. Yeah. So they will go and often are spending the morning hiking to various locations or avalanche risk areas, and they will trigger an avalanche there to sort of see if anything is triggered. And yeah, that's how they keep it safe, really. They do it in a controlled environment rather than it happening uncontrolled with potential people being included.
I've never
And
been
then-
to the snow.
Yeah.
You've never been?
No.
Oh,
That is so strange,
I would
isn't
love
it?
to watch
you'll
you.
have to come and visit me now.
Yeah.
I think I'd be better than you.
I think you'd be way better than me. You would pick it up. You can skateboard. I can barely walk in high heels some days. What do you do then for the day? Like, is it just wait? Like, are you all in a medical centre?
Yeah, is it a clinic?
And who else is there? What other healthcare professionals
What's
are there?
the team?
Yeah, so yep, we are in a clinic. It's at the base of the hill. You work with one doctor and another nurse, and that is everyone you have there for the day. yeah, it is a bit of a waiting game. You have people walking in every now and again, and it can be as simple as needing a Band-Aid for a blister or,
Yeah.
you know, paracetamol,
Yeah.
ibuprofen, that sort of stuff. And then, yeah, ski patrol will bring patients down to you. If it's really critical and they can't extract them from the accident scene
Yeah.
comfortably, then sometimes we're taken to the
Right.
patients to sort of administer pain relief, or, you know, in more serious accidents, have more experienced medical personnel on scene as well. Yeah, so it's a mix of walk-in, ski patrol.
Can you maybe share something that's happened that's really stayed with you, like in that line of work?
Yeah. I think for me, last year, it's actually not per se an accident, but last year it was 8 o'clock in the morning, and I remember I was walking through the clinic to get my cup of coffee, and this bus pulls in, which they never do that, and I thought it was weird, and then I walk outside, and the bus driver is telling me that there's someone on the bus having a fit. So the door opens, walk onto the bus, I'm by myself, and at the end of the bus there's a lot of commotion, and then managed to make it through, and yeah, he's unconscious, not breathing. And so this man essentially had a VF arrest on the back of the ski bus, and we managed to bring him back with 2 shocks, but all done in the back of the seat, because you couldn't move him, and, you know, his poor wife was under his legs because I'd laid him down. And so I think that was one thing that stuck with us purely because of location. I think also timing. If he have done that, you know, on the access road up or anywhere else but reaching the top level car park, would we have had a successful story with being able to resuscitate him?
Yeah, absolutely.
So you're far away from the nearest hospital?
Yeah, in terms of location, it's about a half an hour drive. But we obviously work with the local helicopter crew. So I think by the time we rang them, they reached us within 8 minutes of that phone call being made.
Wow.
So we can sort of turn them around quite quickly. But again, it is 2 nurses and a doctor and ski patrol.
And it must be, even though on the slopes, like thinking about me being left behind, there must be so many people where they're on their own and then they injure themselves and then their family's not there with them.
They're just people even who go there for, you know, a week's holiday, and on day one, I imagine, you see it all the time where it's just turned upside down.
Yeah, definitely. Yeah, it's really unfortunate. And it is one question I ask whenever I find out they're from out of town. I'm like, oh, is this your first day? Like, where are we in your holiday? Because that can, I think, determine how this patient takes their sort of situation and diagnosis. And but yeah, you do have people coming up by themselves, obviously driven up or caught a bus by themselves, that you then have to think about disposition and how do we get, you know, this patient from here to where they need to go. And yeah, again, you get mothers with children whose dad's in China and they're here by themselves and mum's injured. And so now you're having to transfer, you know, not only her, but her child has to accompany. And
what happens in that situation?
We're quite limited.
Yeah.
We don't have a social worker. So with this patient, she actually she had a mid-shaft hip fib fracture. So she was transferred down to Queenstown Hospital via ambulance and then would need to be transferred again to Invercargill, which was 2.5 hours away for definitive care. And it was just a case of having to notify the local hospital that there's going to be a child company because of this situation. And I'm not entirely sure from then how they coordinate that, but that's nothing that we can necessarily
that's the thing.
I don't imagine any sort of first responding type role. It must be something you really just have to learn to deal with the fact you're at the start of these incidences, but then you don't see the follow through and you don't know what happened thereafter. And it must be really hard for any emergency worker.
Yeah, I think we're quite lucky in that we have very close relationships with the local hospital. So our clinical director, he is also employed by the hospital. So thankfully, sometimes on those bigger cases, we do get some feedback. And the same if we're transferring through the Otago Heli service, they get to follow on and they will feed back to us as well. So at least you kind of...
Yeah, you get to close the loop on some of those in terms of the patient outcomes. Is it would you say it's mostly an incredibly stressful job?
And because are you team leading as well?
Yes, I'm team leading for the mountain that I work for. It definitely can be stressful. I think this season, we had the ski field itself had second busiest season on paper in terms of visitors, and we would have had easily the busiest season we've had in terms of presentations. So our busiest day we saw 34 patients. And again, that's, quite a lot for 2 nurses and a doctor. And if you do get one of those more critical injuries, that pulls your entire resource. So it is something that you kind of have to just go through case to case, and, you tend to one patient and get them the treatment that they need and where they need to be, and then you're straight on to the next person.
Yeah, because imagine if you're on one of those more critical cases and you're actually on site somewhere and then there's other people presenting, it would be so overwhelming, kind of where do I need to be?
And then when you've got people without support systems, maybe being a little bit more, higher needs, I guess, in those moments versus if they were here in a hospital where family can just come and see them. Yeah. If they're there alone, I imagine just the emotional support they need is probably higher.
I think it can be in times, especially when, again, going back to that holiday realisation sinks in and they're like, oh, this is day 2, I've got a week left, what am I going to do? Or it's like, we've had teenagers come on school trips from Australia where parents are in Australia and they, have,
broken a bone
that's going to need surgical management, and they're with a school group and there's a few teachers and parents are now having to, book flights to come over. And
does that happen often on school trips?
It's happened a few times.
I feel like that would be like What about, a bit morbid, but is there a lot of fatalities that happen on the mountains?
I'm going to say...
That's so good.
Yeah, no, we have been so far...
So lucky.
Haven't had a mortality in my employment time.
That's right.
I understand Australia's mountains haven't been so lucky this season. I've definitely heard of a couple of losses that they've had. But we have thankfully managed to.
Lucky. How do you switch off? Because, if you have those days where you've had like 30, 40 cases and you're team lead, how do you finish the day? Do you go for a snowboard? Do you just want to get off the mountain?
It's thankfully a big team environment. I'm working with people, especially I'd say ski patrol, who have been friends of mine for years. So, you've all been in there, you've done it together. We often have a hot debrief at the end of the day, have a morning meeting, we'll talk about it. Sometimes it's followed by a beer at the local brewery after you get down the hill, but it is such a very supportive team environment. So I think you do just pull on those supports that you have in that team. And I guess I've been doing it now for quite a while. Yeah. This is my 6th season working up there. I think if you probably asked one of the, newer employees that came on the team this year, they might have hopefully a similar response. But
what keeps you going back? What do you love about it?
It's the people, I think. Definitely the people. Again, working with some really good friends of mine now. I love the environment. snowboarding, skiing when it's not busy is a good perk. But I think also the pre-hospital care aspect of it, which changes your way of thinking compared to working, in a emergency department where it's a lot more structured. And
how does it change your way of thinking?
I think because you are limited, you don't have everything you want on hand. So you're also the first person seeing this patient and assessing this patient, and as opposed to when, they come by ambulance and you've had someone else sort of already start that treatment
they're giving
plan.
a handover straight
It's
away.
really like that remote nursing, isn't it? When
Yeah.
you're first responder.
Yeah. So I just think, you're up there with the basics and you have to do the basics well. And you don't have the luxury of, all the hospital supplies and the state-of-art technology that is coming through those hospital systems now.
You must really develop your critical thinking.
Hopefully,
To make
yeah.
those decisions, particularly when you're leading the team and this is, where to from here.
Yeah,
We need to,
and a lot of it's logistics too. Working again as you do in small remote places where your base hospital is 2.5 hours away, and our local trauma centre is 3.5 hours away. So, I think just holding the patient at the forefront of your mind, and then trying to do what's best for them and put them in the best place that they need to be as quick as they can.
So do you work just the season? Like, are you then contracted? Then is that where you then have stepped into the locum work out in Australia as well?
Yes.
So
how did that come
Yeah.
about? Like, what brought you here to do that?
It's something that I think I'd wanted to do for quite a while. Back in my first season, 2 of the doctors were FACEMs from Australia, and they were encouraging, go and see the world, go and work other places, So I think that was the seed. And then I was offered this team lead position. It was 2.5 years ago now, or 2.5 seasons ago. I took over from a good friend of mine who had fallen to injury as well and couldn't see out the rest of the season. So did it part-time then, and then decided to come on and do it full-time for this season, which is May to October. And it was one of the girls last year that told me about CMR. She had worked with CMR and said really good things, and I decided that I didn't want to go back to, my normal job working in Queenstown. And so, I put an inquiry, and I think it was about 3 weeks towards the end of the season. I had no idea where I was going or what I was going to do or what was next. Yeah. And so one morning I just, put an inquiry in, and then Joe rang me 2 hours later.
Wow. And so what sort of roles have you done out in Australia then?
I've only done 2 contracts so far, and first one was initially in Mackay, which is a regional ED, and then I went through into Moranbah with a friend of mine. Yeah. Regional and
bit rural.
Bit more rural.
Yeah. It's crazy that when you think about it with locum, I think that's the beauty of it, is like 3 weeks before you're like, I don't know what I'm doing or where I'm going. But if you're open to that, like to just grab what's around, you get to see so much.
Yeah. I think it's a learning thing. I think letting go of that sort of financial security as well, and just being okay to be like, oh, this will work out, because it always does.
Yeah.
But it was a great decision.
Yeah.
And so you're here doing more contracts now over the Christmas period for the next couple of months, I believe.
Yes.
What are some of the things that you've really noticed as a difference, to come over and start doing contract work? Are there some things you really need to get in a row before you can do that? If there were some other New Zealand nurses perhaps thinking, I wouldn't mind doing that, what do they need to know?
I think that the hardest thing is actually just making the decision to do it.
Yeah.
And, I was lucky enough, I think, to fall on Joe, who has just helped me and made this process so easy. I think, the differences that I notice is that you turn up on day one and you are on the floor running from the minute you get there,
Is that different to New Zealand?
So I think typically I find we don't have really agency nurses in New Zealand. That's not something that's very common. So more often than not, you're working sort of a casual part-time, or you take on a permanent role, and then you are orientated to that role. So you spend a few days as a supernumerary, and that's where you kind of learn the place, learn the systems.
Yeah.
It's not that first hour that you turn up as you're carrying a
when you're there
patient.
for a
You're
short
walking in
time.
and then here you go, here's all the beds,
well,
go.
Tony, go.
Yeah.
Off you go now. So I definitely think you need to, I think, speak up. Don't be afraid to sort of
Ask questions and
questions.
clarify. And
Yeah, because you will spend time running around. And sometimes people don't help you. You know, in my experience, I think, I've worked in a place where there was 18 agency nurses helping that emergency department, and I think it can get tiresome when you're constantly orientating new people through a system. And so, you just have to sort of be bold and step up and do it and put yourself out there. I don't think in terms of sort of the care delivery, it's not too different. I think your staffing ratios tend to be a little bit more preferable in Australia, which is always a bonus. But I don't think I particularly needed anything special of to get here. It was...
And I guess coming over and being unsure, particularly that financial sort of decision, can I back myself, can I go and, contract around, have the pay rates been favourable as well, and been able, that's given you some confidence that there is work, and I guess you've got support to find work, but that financially that will work out for you? Yes,
definitely. And I think the pay rate generally in Australia is much better, and with working within an agency, is a little bit more better. A little bit better. So I basically doubled my income by coming and doing this over here, and it is sort of a draw card, definitely.
What about the logistics of coming over? So, how long did it take you to get APRA? What else did you have to... Did you realise you need a tax file number? Did you arrive and go, oh my God, I had no idea. Like, if I'm a Kiwi nurse listening now and thinking,
here's my checklist.
I want to earn double.
Yeah.
You can't just get on a plane tomorrow. What's the checklist they need to go through and the time frames?
Yeah. I would say, probably took me maybe a good month to 5 weeks, because you do need APRA, you need your super, that's your tax file number as well, which is something that you can't actually get until you're in Australia. Yeah. So I had a 3-hour layover in Brisbane, and so I was took care of that on my layover into my contract.
Did you get it straight away? Did you get your tax file number straight away?
Yeah, within 24 hours.
Right. What about your APRA though? How long?
APRA, that took probably about 3 weeks.
Right.
And that was actually a lot easier than I anticipated. I think
that will vary, I imagine,
depending on the country that you're coming from as well.
But definitely,
and also the backlog at the time of how busy is it? Is it a busy season where they're processing a lot of applications?
Yeah. I'm not sure what the sort of standard time is, but I think I just put in my personal details and, paid for registration. And I think there is a bit of a reciprocal with the Australian Nursing and New Zealand Nursing Council. So it was a lot smoother than I anticipated. And then I suppose the other thing is getting your indemnity insurance and finding a provider within Australia that can do that for you. And then you come and get a bank account and a phone number and
all those other logistics you think about. You've got to go to the bank, you've got to get yourself set up.
So I guess when you're here, are you contracting around, and often there's accommodation provided obviously for those contracts? Do you have a base in Australia where you sort of base yourself and then go, or are you really going contract to contract in your time here?
I'm contract to contract in my time here.
That's great.
So I, as of now, don't actually have a base. I've just moved out of where I was living in Queenstown before coming here a week ago as well. I'm kind of...
How does it feel?
It's quite freeing. I think,
Is
you know,
it?
just flying by the wind a little bit.
Yeah.
But people will sit there and they'll be like, what are you doing? Where are you going? And you're just like, I have no idea.
Yeah.
You are figuring it out. And, you know, with contracting often too, you're only establishing that connection with these places 4 to 6 weeks prior. So, yeah, and thankfully I've got contracts locked into 25th of January, and then after there I'm free.
They're ready to go.
Yeah.
What about you know, finding your community out here? You know, who did you know anyone out here? Have you found there's a Kiwi community of nurses, or has it been the CMR community that you've lent on?
Yeah, I think I know people here, but they're quite scattered, and so no one was close to anywhere that
It's a
I
big
was
place, isn't
working.
it?
It's huge, and I don't think I realised quite how big.
Had you been to Australia before you started working in Australia?
I had
You
been,
okay,
yeah. But it's, you know, go to the Gold Coast
Yeah, of
and go to
course,
Sydney
yeah.
and go to
Yeah.
Melbourne,
Yeah,
and
yeah.
I think
Not to Moranbah?
not
Yeah.
to Moranbah, no.
No.
I had never heard of it before.
Yeah.
But again, I think you go into these places, and thankfully where I was working at the time was a strong agency presentation, and, you know, we were saying agency looks after agency, so made some really good friends from that. And again, that actually led me to my second contract, where I went with 2 of the girls that I'd met in Mackay. We'd managed to link in together
Yeah.
through CMR,
Yeah.
and go on contract together. So had some connection there already. And then you do, I think, again, in these smaller places, integrate into their small team environment quite quickly. So I don't have a Kiwi nursing
Like
sort of
group. Yeah.
group. It was actually funny and coincidental that I was working with one of the girls who worked on the opposite ski field to me last season
Yeah.
in my first contract. So that was
Yeah, wow.
quite funny to find her in central Queensland.
Yeah.
But I think, again, it's just you have to put your foot out there
Yeah.
and find it.
You have to be quite open, don't you? And I think
Yeah.
adaptable. I think it can be wonderful, and the earnings can be great, and the lifestyle can be great if it is for you. But I think if you just have to be open and know that it's not always going to go to plan, and there's always a solution. Always.
What is the plan then? You know, are you going to locum now around to the next ski season, then go back to Queenstown? Is that kind of, or are you thinking then you go overseas?
So planning to locum through summer. At the moment, have loosely got the idea of going to Japan for a ski holiday in Japan around February, and then it'll be a case of coming back and locuming again until May, and then we'll go back to Queenstown and step into that role again.
That'd be novel, having a ski holiday where you're not actually
Absolutely.
working.
I know.
Like you can actually go
Just
and enjoy it.
Yeah, and everyone raves about Japan. And I haven't done sort of a Northern Hemisphere winter before, so I think it'll just be good to
Yeah,
go
that'd
and
be great.
ski
Totally.
some.
Is there anywhere in Australia that's on your hit list for that time that you hear where you'd love to go and work?
I would love to go to Tasmania.
Yeah.
So I think that's probably where I'm going to try and go in the new year.
Yeah.
And also, I think the Northern Territory is on my list as
Yeah,
well.
that'd be so different too if you compared to like Queenstown and
I know.
yeah, like just the diversity of work there. It's amazing. Because the work you're doing is mostly emergency then
In
Australia.
In Australia, yeah.
Yeah.
Oh no, go on.
No, I predominantly work in emergency, and I just find, you know, like the ski field job, you're often looking after well patients who, you know, have had a traumatic injury, but I feel like you don't get the complex medical care that you find in the emergency department. So I feel like they both feed a little bit of my interest in the job.
Yeah.
And they're very diverse, and I'm not someone who does well with stagnation, so I'm constantly
Hence the locuming around
Yeah.
and moving around.
I think I really enjoy the diversity that it brings.
So you're getting a lot of exposure, and I imagine going into some of these rural contracts, you're going to get really different presentations that you used to, you
Yeah.
know, really from farming incidents, from lots of road trauma to just the caseload will be completely different.
Yeah, and even the venomation medicine, that's not something that you're taught in New
Yeah.
Zealand because, you know, we don't have snakes and deadly jellyfish and, you know.
That's a big learning curve, actually.
It was, yeah.
Was
And
there any other training that you needed to do, like if before you came over here or when you came out here? You know, like that's an example of one where you weren't taught that. Is there anything else?
Not necessarily. I remember onboarding, I had to do modules, and, you know, it's just quite your sort of standard stuff that you would see across in New Zealand as well. Your hand hygiene, your e-blood safe, all of that stuff. Obviously different patient systems in different hospitals, so that is something that I guess you orientate to in each place, but...
It's just a lot of deadly animals.
Deadly animals, yeah. And you know, you kind of have to go and read up about it.
Does that scare you about working here or living here?
Living here, it definitely took me a while to get comfortable. And I remember the first time I came home from an afternoon shift in Mackay and opened my door and there was a huntsman in my room.
Oh, I can't
And
even
I
deal
was-
with them.
I didn't know what to do.
And they're so big. It feels like you're killing like a massive. I can't like.
And I was like, I don't know if, you know, your normal fly spray works on these things.
Yeah,
So I
it
had to ring my
doesn't.
friend. And I was like, what do I do?
Yeah.
She's like, I'm coming over. So
I remember once
She
sitting
did
a
it with
colander
me.
over one, like a big colander, and I was like, I don't know what to do with this.
Yeah,
like,
so
I
the
can't.
Spiders don't worry me so
Oh,
much.
God, they
It's
frighten
more-
me.
It's all the snakes that I am not good with.
yeah, I thankfully haven't dealt or haven't seen in person a snake yet.
You possibly won't, like, you know.
Exactly.
I should go to the NT. You might. Yeah, you might. Working across the two countries, you know, we talk about what's one change that we could make that would make healthcare happier for everyone involved. Is there one thing that comes to mind that you think we could change that would make it better for patients and the healthcare workers?
It always comes down to funding. I think funding gives more staff. It improves access to treatment in a timely manner. I think Australia generally is quicker at getting, you know, interventions in place, and I feel like wait lists, from what my experience, aren't as long to get scans done and those diagnostic interventions than what New Zealand has. But I definitely, unfortunately, it always
Comes down to money.
comes back to money, and it's not something that's easily obtained.
Yeah.
It's a really difficult one, isn't it? Is it being spent in the right places?
Exactly. You know, like in New Zealand recently, they have, or in the last couple of years, had a change of government which has brought massive healthcare cuts. So there's, you know, short staffing and staff hire freezing, and
Which just puts so much more pressure on an
So
already
much
pressured
pressure.
environment.
Yeah.
And then you don't have agency nurses either. So
No.
it's just, yeah.
And then, you know, in some areas, I think I was reading, and it was like 54% of day shifts were short-staffed in nursing sector alone, because of these things. And it's all bigger than us, you know.
Yeah, 'cause then how do you retain the sector? How do you keep people engaged to keep
Exactly.
working in the
And is there a big exodus from those changes of Kiwi nurses wanting to come out to Australia?
I think yes and no. I know a lot that have come and done the contracting side. A lot of my friends have moved over. But then I know a lot of happy nurses working in New Zealand as well, and
Yeah.
enjoy the lifestyle. So
Yeah. It also
it's
comes
very
back to that
personal.
lifestyle and the purpose. And
Yeah.
yeah,
What
you're looking
exactly.
for.
Yeah.
Look, with every episode, CMR are going to make a donation to a charity of your choice. Where can we send that money to for this episode?
I would love to send this through to the Otago Southland Helicopter Rescue Trust. So again, they're the local service that supplies care and helicopter to majority of the South Island.
Yeah.
We work with them in the hospital. We work with them up the ski field, and I think Central Lakes District and Otago region would be lost without them.
Yeah, that's amazing. I love that.
Mm.
Thank you. It's been great. I mean, just hearing about your career and just to be able to have, the opportunity to work in ski fields, to now come out and locum in Australia, like what an amazing opportunity. And, I'm sure there'll be some young people out there that'll be so inspired. For me, when I go skiing next time, I am comfortable that someone is going to be there, and even if I'm on my own, they can get me out of there and they can help me out. And if my kids go on one of those ski holidays,
my son goes on a school ski trip next year, and I'm like, I won't
well,
be there.
we'll have Nicole on speed dial. We're like, hey, it's like, here's your phone. Don't call mum. Call Nicole and do it yourself. So no, it's been a pleasure. Thank you so much.
No, thank you so much for having me, both here today and within the company.
We acknowledge the traditional custodians of the land of which we meet, who for centuries have shared ancient methods of healing and cared for their communities. We pay our respects to elders past and present.